We have proof for the first time, Eva Shoppe published 3 or 4 years ago, that we're finding beta amyloid, p-tau, and biofilms on autopsy patients with Alzheimer's and Parkinson's. But we never had an in vivo person who was alive who took a biofilm persister drug regimen like dapsone combination therapy and said, well, okay, can we reverse these markers? What happens? It's the first time. It's huge.
Hi, and welcome to the Lyme Bites podcast, where we shine a light on the misunderstood science of Lyme and other vector-borne diseases, as well as the truths that many still miss. I'm Dr. Mariah Hinchy, naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs. I specialize in treating chronic Lyme disease as well as other complex inflammatory conditions. In this podcast, we break down what's working and what's not. We share the facts that most people miss, we challenge outdated thinking, and we give both patients and practitioners the tools to heal smarter. So let's get into it and change the way we heal Lyme. Hi, everyone. Welcome. I am your host, Dr. Mariah Hinchy, and I'm here with Dr. Richard Horowitz. And today we're going to talk about neuroinflammation and the link between chronic Lyme disease and Alzheimer's, as well as neuroinflammation in general. So thank you so much for joining me, Dr. Horowitz.
My pleasure. Good to see you as always.
Absolutely. So chronic Lyme disease patients often have inflammation as the underlying cause of most of their symptoms. Let's talk a bit about how that inflammation affects symptoms of cognition, including brain fog.
Yeah, so when people complain of symptoms of, I'm tired, I have muscle aches, I have joint aches, I have nerve pain, tingling, numbness, burning, stabbing sensations, I can't fall asleep, I keep waking up in the middle of the night, I can't remember words, I'm walking into rooms and forgetting why I walked in, they have word finding problems, number of problems. All of this is basically from inflammation. So Lyme disease, and in our case, and I think it's your practice too, it's not just Lyme that's driving the inflammation. I mean, in most of our cases, Bartonella is just right behind it, probably 80 to 90% of the cases. Babesia is not too far behind that, probably at least 70 or 80%. And then, we're also seeing reactivated viruses, like some of the long COVID patients have had reactivated Epstein-Barr, herpes virus 6. But we're also seeing inflammation coming from mold toxins, from heavy metals. So the inflammation is not just coming from Lyme, but Lyme is one of the major factors that's driving the inflammation. And the reason I wanted to do this specifically, talk about this today, is because Alzheimer's disease is a big problem, not only just in the United States, where they're expecting the numbers. The U.S. numbers from years ago is that there was 46.5 million people with preclinical dementia. 46 point. And when you look at the studies on Alzheimer's, the rates doubled roughly in the last 12 years. They're expecting like 55 million people in the world based by 2060 that are going to be demented. So it's the fifth leading cause of death. And we talk about it all the time, but I think when we talk about Lyme disease, nobody's really ever put together the fact that it is actually one of the causes of why someone may get Alzheimer's. And I'll give you a perfect example. We're going to talk about a couple of cases today, including a case study that I submitted to the Journal of Alzheimer's Disease Case Studies. One of my patients in Massachusetts was diagnosed with Alzheimer's disease. And the neurologist who saw him had a positive F18 PET scan, showed amyloid production. The neurologist never checked him for Lyme or Bartonella. The neurologist never checked him for mold. In other words, he never checked him for any of the 16 MSIDS factors and started him on lecanemab, which is this monoclonal antibody that, pulls out amyloid. But the problem is 15 to 20% of the cases can get brain bleeds and brain shrinkage, and it doesn't stop the process from going forward. So I said to the patient and the family, let's do a Lyme immunoblot. It lit up like a Christmas tree. His Bartonella immunoblot was positive. His Bartonella fish was positive. And we just got back mold toxins that are off the wall elevated. So he's got multiple factors driving inflammation. So if you're a Lyme patient and you have chronic Lyme disease, post-treatment Lyme disease syndrome, and you're complaining of symptoms, fatigue, joint pain, muscle pain, nerve pain, sleep disorders, memory, just know that inflammation is really one of the major reasons why you have it. And the reason I keep talking always in this point, couple of decades about the MSIDS model is the inflammation is usually not just coming from Lyme disease. But one of the most interesting things we're going to discuss today is just a couple of years back, Dr. Eva Shoppy and her group discovered, and this is autopsy cases, not live cases, that amyloid, p-tau, phosphorylated tau, and biofilms were found for Lyme disease in the brains of people, autopsy patients with Alzheimer's and Parkinson's. So we have proof that Lyme disease may be one of the underlying causes, and we'll talk in a second about how frequent I think that is. But the fact is that up until a couple of years ago, we didn't have easy biomarkers. In the last 2 years, I started going to Quest and LabCorp and looking at some of these biomarkers that are now widely available. And I've got the codes for everybody today, so you can listen to this talk and you can kind of write down the codes and speak to your doctor about it. I'll talk to in just in a second about it. Instead of doing spinal taps, very invasive, or going for F-18 PET scans, you now have the ability to go to Quest or LabCorp, and I specifically like Quest Labs a bit better based on the LabCorp testing I've gotten, but you can check markers like ApoE to see what is your genetic risk of Alzheimer's. If it's 4/4, you have a higher genetic risk. You can check a marker called p-tau 217. This marker is highly associated with beta amyloid in the brain and has been shown that if you have an elevated p-tau 217, the odds of becoming demented 15 to 20 years later is quite high. And the case I'm going to talk to you about today, that was her case. This is a 60-year-old woman, came to me for 15 years, mild Lyme symptoms. She had an EM rash, was treated, but still had some joint pain. Rheumatoid factors were elevated, and she told me her cognition she thought was fine. So over the years, we were using Byron White herbs, we were using Beyond Balance herbs, we were using Cowden herbs, we were using all kinds of natural things because she wasn't sick enough to do antibiotics. And there came a point when these biomarkers became available from Quest. I said to her, I started checking my Lyme patients, and I noticed that over 50% of the patients were starting to test positive for these biomarkers of inflammation. And I said, would you be willing to do it? She said, sure. So she did the test, and her p-tau 217 was elevated above range. Beta amyloid was normal, but because of the p-tau and because she had a family history of Alzheimer's, although her marker, she was ApoE33, her grandmother had Alzheimer's, she decided to do dapsone. And lo and behold, we saw a lowering down of the p-tau 217 3 months later. Now, for those of you listening to this may not mean a lot to you, but this is the first case study that has ever been published in the medical literature that we can go in and we can reverse these type of Alzheimer's biomarkers and hopefully prevent cognitive decline later in life. Now, again, it's going to need to be proven in a multi-center, double-blind, placebo-controlled trial, but we're talking that about a study now that has really, really big implications for people. So I wanted to make sure that you and I had a chance to kind of go into this in detail and share it with people.
Yeah, no, this is great. So you mentioned two of the markers. Since we're already talking about it, why don't you be complete with that list that our listeners can actually ask their doctors to test them for at Quest or LabCorp? Are you ready to revolutionize your approach to diagnosing and healing complex chronic inflammatory illnesses in both adults and children? The Lyme Bites Symposium is your gateway to cutting-edge education, groundbreaking research, and innovative therapeutic solutions. Join us at Lyme Bites Symposium at the Fort Lauderdale Marriott, Pompano Beach Resort and Spa. Lyme Bites is the premier functional medicine conference on complex, chronic, infection-driven inflammatory illnesses. This year's meeting is jam-packed with leading industry experts discussing long COVID, mycotoxin illness, PANS pandas, as well as Lyme and other vector-borne diseases. This conference will arm you with the knowledge, clinical pearls, and practical solutions that you can implement immediately into your practice Monday morning that will literally change your patients' lives and get them on their path to true healing. So join us at Pompano Beach or virtually from anywhere. Register now at lymebites.com. That's LYMEBYTES.com.
Right. So the other markers, so you can get a beta amyloid ratio. In fact, I wrote down the codes here from Quest. The beta amyloid ratio code 4240 is 11786. Beta amyloid 4240 ratio number 11786. P-tau 217 that we were describing, the code from Quest is number 13825. Again, p-tau 217, number 13825. P-tau 181, the number is number 13690. Again, number 13690. Neurofilament light, another marker of neuroinflammation. That quest code is number 13979. It's called NFL, neurofilament light, number 13979. And if you want to check your genetic markers for ApoE, it's number 12563. So these are the markers that we started doing on our patients. And again, I started doing this towards the end of my one-on-one clinical career, right? I've now moved into consulting model. So unfortunately, we did not have the chance to do before and after markers in these patients because most of my patients had already done a dapsone combination therapy. So this woman had put off doing dapsone for 15 years. The only reason she basically did it was because her rheumatoid factor was still elevated with some joint pain. The p-tau 217 was elevated. And I said, listen, I don't have any evidence that we are going to reverse this, but I will tell you, based on what I've read in the literature, that they know with Alzheimer's disease in autopsy studies, they found Lyme, they found biofilms, they found p-tau, they found beta amyloid. I said, and we know that dapsone has great penetration into the brain. The number one effect from dapsone, statistically significant, is improving cognition. I said, you're one of the few patients who has never done it. Would you be willing to? She did it. And again, we checked the markers 3 months later. Her rheumatoid factor reversed back down to normal. Joint pain got better. And interesting, we didn't know she had cognitive issues because she thought her meditation practice was contributing to her good cognition. She said to me afterwards, and I put this in the paper that we reported, that she found that she was definitely clearer, like the word recall was better. So what she was assuming was taking good care of herself. I'm meditating, I'm exercising, I'm getting enough sleep. Was like, no, I absolutely see a difference. Really fascinating. Yeah, so those are the markers that you want to speak to your doctor about. And I want to be clear with people. Don't freak out if you do these tests and they come back positive. It's not like we're going to talk today during this talk with Mariah. We're going to talk about what you actually can do for this because Alzheimer's is not a death sentence. I'm publishing in the literature, this is also in the case study that we're reporting to the Journal of Alzheimer's Case Studies, that all 16 MSIDS factors that we've been talking about for chronic Lyme now in my best-selling books, Why Can't I Get Better? How Can I Get Better? We'll be discussing it also in a new book from Simon & Schuster, which will be out later this year, called Ending Chronic Illness. I have a whole section in the book on Alzheimer's and how all 16 factors on the MSIDS model are associated. So if these markers come back positive, you're not going to all of a sudden just worry, oh my God, I have to go on Aricept or Namenda or some of these drugs that are out there. What you need to do is go back and say, where is the inflammation coming from? Check your genetic markers for ApoE, but check for infections. Do I have chlamydia pneumonia? And chlamydia pneumonia is also an intracellular infection that's been associated with Alzheimer's, just as Borrelia burgdorferi and even denticola spirochetes from the mouth. H. pylori. Q fever, Coxiella burnetii, it's one of the tick-borne infections. It's published in the medical literature that it is associated with Alzheimer's dementia, but so is herpes virus 1, herpes virus 6, herpes virus 7, CMV. So there's viruses that are associated, and there are, again, antiviral treatments that may be able to help in that case. The point being, if you do get back these markers, you don't just go to a neurologist and say, put me on Namenda, put me on an acetylcholinesterase inhibitor, because that does not change the course of Alzheimer's. It may improve your memory, but it's not going to change the clinical course. You actually need to find out where the inflammation is coming from. So I think that's the most important point, because in the patients that I checked before we finished one-on-one practice, and I've got 10 of them here briefly, I'll talk to you about sometime during the talk today. 3 of those patients who finished dapsone, the p-tau levels were fine. And the beta amyloid ratios were completely normal. But in 7 of them who never finished dapsone, they did have these elevated markers, whether it was beta amyloid, p-tau 181, p-tau 217, or neurofilament light. Well, I'll go into some of those cases later, but it's important to kind of think about this, because when you go to your doctor now for treatment for Lyme, there's so many treatments out there. What I'm suggesting is we now need to kind of not necessarily raise the bar, But add this piece of information, just like you would check for co-infections, just like you would check for mold and heavy metals. And many times we check autoimmune markers like anti-nuclear antibody, rheumatoid factors, which this woman had. She was not CCP positive. She did not have the autoimmune marker for rheumatoid arthritis. It was not an autoimmune. It was an autoimmune problem she had from the Lyme, which reversed when she finished the dapsone. So again, I think these markers now need to be incorporated because the Alzheimer's rates we're talking about, they're going up significantly as time goes on. It's the fifth leading cause of death in America going forward. And I think now that we know that Lyme, Borrelia burgdorferi can be associated, and we know that dapsone has great penetration into the brain, I need docs out there to start looking at this. Obviously, the randomized multi-center study will help us to determine, right, with longer term follow-ups, whether what we found actually is going to hold up, right, in the scientific literature.
Right. So I think, the take home point from all of that is that there are markers and we can have these markers tested and they can actually give us clues before the full on, disease process has taken over. So we can look at these, we can use these to screen. And if we see that they're elevated, we can use them as warning signs, but also a guide as to how to help that patient. So if you do have these markers elevated, you should be looking for all of the, Borrelias, all of the co-infections, all of the viruses that often will overrun the body when the immune system has been skewed from one of these vector-borne diseases. And obviously, we have to get to that root cause. We have to look at eliminating these infections, but also we have to deal with that neuroinflammation that is driving the process. Because I think the thing that we've left out so far in this conversation is that the development of beta amyloid plaque and or p-tau is actually the body's innate defense to trying to deal with these organisms presence in the brain because they shouldn't be there. But when they can get there through a leaky blood brain barrier, because of the neuroinflammation, it turns into this vicious cycle. So while we're trying to identify and eliminate these underlying causes, there's a whole host of things that we can do to deal with the neuroinflammation and actually start to, pull out the beta amyloid plaque, like using curcumin, using Chinese skullcap, using green tea. And then amazingly, these same agents actually help to decrease p-tau as well. So, as Dr. Horowitz said, don't freak out. If you come back with these markers, it's not a death sentence. Use them to guide you and work with your practitioners to really get to the root causes, the root infections that are driving this actual, like, normal process in the body that your body is literally trying to protect you from these organisms. Wouldn't you agree, Dr. Horowitz?
No, absolutely. And let me just read. This is directly from the article that I submitted. Let me just show you the 16 MSIDS factors so you have a sense of what this is. So we
Yeah.
talked about chlamydia pneumonia. We talked about Lyme disease driving amyloid production in the brain. H. pylori, Coxiella, Burnetti, Q fever, herpes viruses. So toxoplasmosis, right? 1/3 of the world's population has been exposed to toxo. It's not always active, but if it is active, it's been shown to be one of those causes. Fungal infections, candida infections, malassezia, there's other fungal species that have been associated. They actually find these fungal species in the brains of Alzheimer's patients on autopsies. Environmental toxins, air pollution like fine particulate matter. So heavy metals, pesticides have been associated with amyloid production and p-tau. Microbiome abnormalities, decreased diversity and abundance of your beneficial bacteria. So you could do a GI map, you can do a CDSA, you can look at the microbiome to see whether you've got the right type of short-chain fatty acid bacteria that lower inflammation. Intestinal hyperpermeability with leaky gut. You were mentioning the leaky blood-brain barrier. This is also a problem with leaky gut, with or without mast cell activation. Vitamin mineral deficiencies, B12 deficiency, B6, B9, folic acid, vitamin D, vitamin E, all published in the medical literature associated with Alzheimer's dementia. Not getting to sleep, which is a problem with Lyme disease, of course, where you don't fall asleep or wake up frequently. That will drive some of this phosphorylated tau in the brain and beta amyloid. And finally, the 10 downstream effects on the MSIDS model that have been associated is mitochondrial dysfunction, hormone and immune dysregulation, autoimmunity, liver disease like non-alcoholic steatohepatitis, fatty liver, which is affecting a third of the world's population. It causes insulin resistance, which has been associated also with problems with dementia, neurological, psychological trauma and dysfunction, autonomic dysfunction, as we see in many of our patients, deconditioning and pain syndromes. So every one of the 16-point MSIDS model factors have been associated with Alzheimer's. So if you do, again, these markers, you go to your doctor and you go, I have to be checked for all of these things. And if it turns out that the Lyme is active and you've not used a persistor biofilm regimen, what I am suggesting is that your doctor wants to do it before and after with these markers, and then we can accumulate the data. And again, it can be published in the literature.
So, where can our listeners find that complete list?
Well, hopefully this article, by the time our Lyme Summit is out in May, the article should normally be published in the Journal of Alzheimer's Disease Case Studies, but also the Alzheimer's section. All of these are found in my new book, Ending Chronic Illness. The website is endingchronicillness.com. The book will be out later this year. But interestingly enough, what we found with the 16-point MSIDS map is it's not only affecting chronic Lyme patients with PTLD. We published 2 years ago that it's associated with long COVID. All 16 MSIDS factors are seen in long COVID. And before I got the contract for Simon & Schuster to do this book, we knew Alzheimer's. That was the one that I pitched the book. But since then, we discovered that the 16-point MSIDS model is associated with ADD, ADHD, with autism spectrum disorder, with allergies and asthma, with the 3 Bs, Borrelia, Bartonella, Babesia, with the Cs, cancer, cardiovascular disease, chronic fatigue syndrome, myalgic encephalomyelitis, fibromyalgia, digestive disorders like Crohn's ulcerative colitis, functional medicine disorders, autoimmune disorders like rheumatoid arthritis and MS, hormonal dysregulation. In other words, all of the things that we find in our Lyme patients that are causing chronic illness in this country and across the world. When I did a deep dive in the medical literature, and I have approximately 2,000 references backing this up. In fact, there's so many that they can't even put them in the book. They're putting it on my website. All of these different diseases, right, including long COVID, including hormonal dysregulation, all 16 factors are showing up in all of these diseases, which is amazing. It means we now have the ability to have a paradigm shift. So if you are a Lyme patient who has ADD, or you're a mother with Lyme disease and you may have passed on the Lyme to your child, and we've seen this happen with autistic kids. I have some of the practitioners out there that have used low-dose dapsone and seen that sometimes the brains do work up in these children. The point being, we now have a new model for chronic illness. So in this case, we're talking about Alzheimer's, but all of the 16 factors and exactly how they relate, they will be in the paper that'll be published in the Journal of Alzheimer's Case Studies and also in Ending Chronic Illness.
That's amazing. That's such, as I told you when I first laid eyes on your book, like this book needs to be a desktop reference for physicians. And, it's funny, like as a naturopathic doctor, I mean, the way that you're approaching this is kind of like the way that I was taught to approach really any illness, when you're working somebody up. So it's so important to look at all of the pieces of the puzzle and do personalized, individualized medicine, like with that patient sitting right in front of you. So I'm so glad that you have this as a reference for
Yeah, I
everybody.
mean, when I've spoken to naturopaths in the past, it seems like I'm more in line with the naturopathic population than I sometimes
You
am,
are.
even with my own. But what's so strange about it is, that the healthcare costs in this country, 18% of our GDP is healthcare costs, and 86% of our healthcare costs are chronic disease. 70% of our healthcare costs are relate to deaths in this country, and we have no model for chronic illness. Right. So the levels of chronic illness keep going up. 1 in 2 Americans has one chronic disease. Two, I think about 25% of Americans have 2 or more. So we're dealing with a chronic disease epidemic in this country and in the world. And there's no model to be addressing it. What we've done in medicine, unfortunately, is we name the disease and we throw drugs at it. And I have nothing against the pharmaceutical industry.
Yeah.
Dapsone combination therapy uses a lot of these drugs, but that's not the root cause medicine. Root cause medicine means you name the disease and get to the underlying 16 factors. So then maybe you still will use some of these medicines, but there's also, and I have stories informing every chapter in this book. These are personal patients, over 41 years of seeing 13,000 of these chronically ill patients, where we've reversed ADD in these patients, and the autism spectrum disorder got better, and the allergies got better, and the migraines got better. These are all just informed by you didn't get through all the 16 MSIDS factors. So instead of just here's your migraine medicine, right? Oh, you were missing magnesium. You had mitochondrial dysfunction. You needed CoQ10. Your blood sugar swings with mast cell disorder was driving your migraines. We don't think that you think this way, and I think this way, but it's just not been taught, I think, in medical school. So you're right. I mean, I hope this book gets into the hands of doctors and patients as kind of like the next Burke manual of when you have something wrong with you, look up the 16 root causes. Because in the book, I describe not just the pharmaceuticals, but all of the pathways, all the inflammatory pathways. By the way, what's interesting, I didn't mention this. I found when I was doing the research that even though there are 16 MSIDS factors underlying all these chronic diseases, including Alzheimer's, there are 16 inflammatory pathways underlying the 16 MSIDS factors. So a lot of times you and I have talked about NF-kappa. It's one of these inflammatory pathways, turns on TNF alpha, interleukin 1, interleukin 6, IL-17, drives inflammation. The NRF2 pathway that lowers inflammation. And in Alzheimer's, this third pathway is called NLRP3 inflammasomes. So the beta amyloid and phosphorylated tau that's clogging up your neurons when you can't think is coming from inflammation in the brain from microglia, these small cells in the brain that turn on a third inflammatory pathway called the NLRP inflammasome. And you and I have discussed in another episode here how we shut down the NLRP3 inflammasomes, right? Using low-dose naltrexone, low-dose melatonin, some of the herbs you just discussed. But also, dapsone is a neuroinflammation inhibitor. So in a study that was done about 4 years ago in Korea with over 3,000 leprosy patients, they followed them for 15 years. The leprosy patients who took rifampin and dapsone, which is part of the dapsone protocol, that's how I got it, the rates of Alzheimer's disease were like 6 times less if they took dapsone. The leprosy patients that didn't take dapsone, the Alzheimer's rates were off the wall. Now, they were suspecting that the reason the Alzheimer's was stopped by dapsone, right, is because it was acting as an NLRP3 inflammasome inhibitor. It was stopping the inflammation in the brain, driving beta amyloid, driving phosphorylated tau. Now, we don't know whether those Korean patients had Lyme disease or not. We don't even know how many of the 16 MSIDS factors they had. But interestingly enough, you hear about all these Alzheimer's drugs, you never hear about dapsone. And I had a patient in the Midwest. She's 80 years old. She's one of the 10 patients I was going to discuss today. She took 25 milligrams of dapsone, which for me is almost like homeopathic dapsone, like literally no side effects. You don't notice it. And she told me after a year and a half, she said, my memory is so much better. But we recently tested her. She came to see me in New York right before I finished clinical practice, and we tested her. And one of her Alzheimer's markers, her p-tau 181, was elevated. And I said to her, listen, you clearly notice your memory was better from even the low-dose dapsone. And she's not even noticing a lot of memory issues, but a couple of word-finding problems, which you might say at 80 years old is normal, but can we do better? I said to her, listen, you really need to consider doing the higher dose dapsone, but then we tested her and we're finding mold. And so the point being, you don't just accept the diagnosis, right? You don't just accept your cognitive issues. Get to the 16-point MSIDS model to find out what's underlying the inflammation. And then we may have other options. For some people, it may be dapsone combination therapy. This is, again, one case study, but the first one ever published in the medical literature that we can reverse p-tau 217, which is the most important biomarker that people go on to dementia later on. So it's really exciting information for the Lyme community that this is something that not just makes you feel better with fatigue and joint pain, but might, and I say might be able to prevent cognitive issues and dementia later on in life.
Yeah. And I mean, that's just, I think, even knowing these markers, looking at them more as a screen, right? So that you can prevent, because earlier you had said that these markers could predict like severe dementia or Alzheimer's. Wasn't it like over a decade later? Are you suffering from Lyme disease or another complex chronic illness and aren't sure who to trust when it comes to herbal supplements? Hi, I'm Dr. Mariah Hinchy, founder of Lyme Core Botanicals. As a naturopathic physician specializing in complex chronic infection driven illnesses like Lyme disease, I needed herbal medicine I could truly trust. That's why I formulated Lyme Core Botanicals, where our herbal tinctures are handcrafted in small batches right here in Connecticut. We use the whole herb, never isolates, to preserve the full spectrum of medicinal compounds. Every single step from sourcing to extraction is done with precision to ensure maximum purity, potency, and consistency. These are the same herbal formulas I use to heal myself and have used for years to help my patients and family members heal too. And now I'm making them available to practitioners and patients everywhere. Lyme Core Botanicals, herbal medicine you can trust from a doctor who lives this work. Learn more at Lyme Core Botanicals. That's LYMECORE.com.
It's like even 15 to 20 years later, the p-tau 217, it's 15 to 20 years down the line. So if you're someone who finds it, this is not an immediate like death sentence, you're going to develop Alzheimer's, but it does mean that you have something going on in your brain, right? You've got inflammation going on.
Right.
And now you got to figure out where the inflammation's coming from. So again, the standard medical model, which I don't use or you don't use, where you name the disease and throw drugs at it, it's about getting to the underlying inflammation, right?
Right.
What are the 16-point MSIDS factors? And what's interesting is Judith McCloskey years ago, she's published 4 to 5 articles that there's absolutely no doubt that Lyme has an association with Borrelia. When they did autopsy studies, they found that Lyme was 10 times more frequent, right? When they were looking at these autopsy cases of these Alzheimer's. So we know that there's an association. She called it by Cox and Hill's criteria that it's indisputable. There's a statistical relationship. It is one of the causes. And they found that in the Alzheimer's cases they looked at, it was 10 times more frequent people had chronic Lyme disease. So, the politics, the dysfunctional medical politics of Lyme, unfortunately, is it a chronic persistent infection? Is it not a chronic persistent infection? What causes it? It's hurt the Alzheimer's research also because it is a chronic persistent infection. And if you're going to deny that these biofilm persister forms in the brain that create beta amyloid, that increase p-tau, that are now being talked about through Eva Shappi's group and Dr. McCloskey, it's important to know that there may be, again, it's one case study, we can't say much, but it's exciting because I didn't know whether I was going to be able to reverse the p-tau 217. It's never been done. Right. So it's like, wow, maybe this is going to be something that will affect a large millions and millions of people may be able to get better from this. But also the woman who was 80 who did low dose dapsone, who said to me, my memory improved, maybe in the study they did in Korea, it was 100 of dapsone. Right. They treat leprosy with 100, not double dose 200, not high dose used for Bartonella. Maybe 100 of dapsone is all people need instead of worrying about lecanemab and these drugs that are very expensive and shrink your brain and cause brain bleeds. So there's I think, new things we can talk about here that's really quite exciting. But we chose the Neuroinflammation Brain Protection Summit to talk about this was because of some of this that is now showing up that when I started testing my Lyme patients and seeing so many of them, we're starting to have these markers. I have a 50-year-old woman in Connecticut who's a professor. She did a 2-week dapsone pulse. She had Bartonella and said to me, because she never wanted to do the full protocol, she said, oh, I feel so much better. I tested her. Her p-tau 181 marker was elevated. She's 50 years old. And I said to her, listen, you got to follow up with your doctor here and finish the protocol and look at the 16 MSIDS factors. But, when we go to the doctor and you check your blood pressure and you check your cholesterol and you go for mammography to rule out breast cancer and colonoscopies and digital rectal exams with PSAs for prostate, it's not on the list of things your doctor normally does, which is to say, how's my p-tau and my beta amyloid, doctor? It's not standard medicine. Why? Because they don't know what to do for you. They
Right.
have no idea. If it comes back positive, it's like, well, what do we do? I'm suggesting that you go through the 16-point MSIDS model, which has been published in the literature to be associated with dementia, and then maybe consider the 9-week oral dapsone combination therapy and some of the herbs, right, Mariah, that you're using that also have scientific validation.
Right. It doesn't make sense to me when we can measure the markers and we know that these markers, like beta amyloid and p-tau, are reacting in response to an organism, right? Well, it just doesn't even make common sense to me as to why we wouldn't go through and look for all of the various organisms that could be causing this response in the body, right? Because then we would be doing real root cause medicine instead of using a monoclonal antibody to kind of like clean up the mess without turning off the sink. Like to me, it's like using the lecanemab is like, we're mopping up the floor, but like we haven't turned the faucet off that's making the sink overflow. You
Exactly right. It makes no sense to you or me, especially because infections cause beta amyloid. We talked about this in another podcast that the beta amyloid is protective. Your body is actually creating it to try and shield off the organism, except the problem is it keeps accumulating. It then starts to drive phosphorylated tau, and the neuronal connections just don't work over time, right? But you're right. Root cause medicine in this case is going to be essential, especially with the numbers of Alzheimer's cases that are expected to double in the next 25 or 30 years.
Yeah. So tell our listeners a little bit more about these 10 patients that you're going to talk to us about. And do you want to say anything more about the study and your paper that you've
So the main thing about the paper is that when I went through this patient, who was roughly 60 years old, she had never, one of the few had never done dapsone. She had an elevated rheumatoid factor with joint pain, but CCP negative. She did not have rheumatoid arthritis. She had an elevated p-tau 217, one of the most important markers that gives you a chance of having dementia later on, again, 15, 20 years down the line. And again, she wasn't even complaining of cognitive issues. But she also, by the way, had two Bartonella species. Her Bartonella henselae and Bartonella quintana were positive. She had evidence of exposure to Q fever, Coxiella burnetii. All of these organisms can be associated with amyloid production and dementia. And she also had heavy metals. We chelated her years ago for lead and for mercury. So we looked for all these MSIDS factors and we dealt with all the factors that we could. And she was doing so well. She would come in once a year. She wasn't one of these chronically ill patients. She would come in and go, "Oh, I got in a car accident. I need a little physical therapy because my knee's not working." But she was saying, "Oh, I'm a little stiff, but I walk every day. I'm doing great." It wasn't actually until we checked these biomarkers and the p-tau came back. And I didn't even think to do like a mini cog exam. You can do these small mini mental state examinations to check cognition because she wasn't even complaining of cognitive problems. And lo and behold, we do the protocol. 3 months later, I check the Quest labs. The number of the p-tau reversed down to normal, first time published in the literature. The rheumatoid factors now are negative, meaning we reversed peripheral inflammation and theoretically reversed neuroinflammation, right? So it's an amazing case study because we have proof for the first time. Eva Shapi published 3 or 4 years ago that we're finding beta amyloid, p-tau, and biofilms on autopsy patients with Alzheimer's and Parkinson's, but we never had an in vivo person who is alive who took a biofilm persister drug regimen like dapsone combination therapy and said, well, okay, can we reverse these markers? What happens? It's the first time. It's huge. But now I need naturopaths, ILADS doctors, all the doctors out there who are listening and all the patients listening. Again, don't freak out because based on what I've seen, you probably got about a 50-50 shot that these markers may come back positive. But just like if your cholesterol is elevated, you're going to get on a diet, an exercise program, and you might consider a statin or do red yeast rice, whatever it is you're going to do, bergamot. The point being, there are things you can do. This is not a life sentence that my life is over, but it does require now going through the 16-point MSIDS factor. And as Mariah said, you can check for chlamydia pneumonia. You can check for H. pylori. You can check to see if Borrelia burgdorferi is active. These are all things that you can do. And then saying, okay, these biofilm persister drug regimens, Horowitz has been publishing on them for 10 years. I do have a consultation model. I'm, believe me, not looking for work. As I told Mariah earlier before we got on, I had 75 emails yesterday of people calling me from all over the world. I publish these articles in the peer-reviewed literature, so it's open access. Your doctors can read them. They don't necessarily have to contact me, but if they need my help, right, I am available. You just go on the cangetbetter.com website and look under the consultation service. But all 10 articles on dapsone, how it lowers down the biofilm persister forms in culture, the tough study, showing that we were able to cure Lyme in the mouse model when they failed doxycycline. And then the 8 other studies that we did, about 350 retrospective patients, showing that memory concentration improved, fatigue improved, joint pain improved, muscle pain, neuropathy improved, fever, sweats, chills, babesia symptoms, mood. We've published this all over the last 10 years. It's taken me about a decade to tweak the dapsone protocol to get it to be 8 to 9 weeks. And then if it's Bartonella, it's short-term 2-week pulses. And again, the full protocol are written out, again, apart from microorganisms, September 2023, and the journal Microorganisms, April 2024, when I have 3 case studies showing how, again, we've reversed the symptoms of chronic Lyme. I have a Substack called Medical Detective. It's free to sign up. The 5 Bartonella Substacks that I did, numbers 4 and 5, have the entire dapsone protocol written out in detail, and number 5 is for the 2-week pulse for active Bartonella. So I've got all of this out there published for you. Your doctor can access it, and if your doctor has any questions, please have them contact me at my email, medical@hvhac.com. It stands for Hudson Valley Healing Arts Center.
Thank you. So, switching gears a little bit, since Alzheimer's is the 5th leading cause of death in Americans 65 and older, and we also know that Medicare patients have up to 7 times higher rates than what is generally reported with Lyme disease, what do you think HHS and the health department should be doing at this point regarding this epidemic and the link? Like the pretty blatant link between the two.
Yeah, from my perspective, what HHS needs to be doing at this point, because our Secretary of Health Kennedy has really said he doesn't like the medical model we're using. In fact, root cause medicine, I've not had a chance to speak to him, but I bet based on what I know from Casey Means and people around him, well, you and I are discussing today a root cause medicine. I mean, he focuses a lot on diet and exercise, which is great.
Yep.
But we're in the middle of a Lyme epidemic, and the Medicare rates are 7 times higher. So if the CDC is saying 6,000 people, roughly 500,000 a year, are getting Lyme, it's 7 times higher in Medicare. I don't know what that means. Is that 3 million people per year in Medicare are getting Lyme? And we know that Lyme has been associated with Alzheimer's, where the rates are 10 times higher, and that they're finding on autopsy 1/4 of all Alzheimer's cases on autopsy are due to Borrelia burgdorferi Lyme. What it means for me, for HHS, is get a randomized multi-center placebo-controlled study of dapsone combination therapy done, and add these Alzheimer's biomarkers with p-tau 181, p-tau 217, amyloid 42/40 ratios, neurofilament light, and ApoE status. Do these 5 markers in a randomized multi-center placebo trial. So you're not only looking at how is the fatigue, how is my pain, how is my cognition? You can measure it with, some of the very short measuring like minicog. You can measure these things, but now we can measure the biomarkers before and after. And if you do it in a placebo study, we will not only see how well people do with chronic Lyme, but we will have an indication whether we can, in fact, reverse inflammation in the brain, right? Dapsone's blocking NLRP3 inflammasomes, maybe taking down the load of Borrelia in the brain. We have a study that absolutely needs to be done. I had submitted an R34 grant last year. I'm sorry to say it was turned down by the NIH reviewers. I'm not sure Secretary Kennedy knows this. It took me 4 months working with Eva Garland Consulting through my 501c3. We paid them like $32,000 for me to get this study done and go through all the hoops. They still denied it. I was giving them, it was $250,000 I was asking for. So now I have to reapply. And I have certain people I spoke to in the government who are going to look for other funding opportunities. But we've got an Alzheimer's epidemic. We've got a Lyme epidemic. HHS needs to look at this research that's been published, right? And say, okay, the time has come. Let's not put this off. Let's get some reviewers on board, basically, who say, yeah, this is an important study to do.
Yeah, absolutely. So, what would your final words of advice be to our listeners who either themselves or have a loved one that's suffering from chronic memory, concentration, focus issues? What sort of workup? I know we've already gone through it, but summarize, what would you recommend they do first and how do they talk to their physician?
So most doctors, they're going to start with simple things like, where's your B12 level? Let me check your folic acid. How's your thyroid functions? Do you have hypothyroidism? They're going to start with some of the easy stuff. Get a CBC, a biochem profile. But ultimately, what we found in doing this deep dive in the medical literature is that all 16 MSIDS factors that I've published for chronic Lyme and that I've published for long COVID are associated with Alzheimer's dementia. So what you just need to do with your doctor is go through all of these 16 factors, the first six, by the way, of infections, environmental toxins, leaky gut, mast cell activation, microbiome issues, sleep disorders, vitamin mineral deficiencies. Those are the six, I call them the rivers of inflammation that drive or that cause an ocean of inflammation. You go through those with your doctor piece by piece, and then you look at the 10 downstream effects of the inflammation. Do I have mitochondrial dysfunction, which has been, by the way, associated with Alzheimer's? There are doctors out there looking at low-dose methylene blue, which we use in the dapsone protocol to reverse mitochondrial dysfunction because they're finding that some of these Alzheimer's patients are getting better, supporting the mitochondria without necessarily trying to pull out beta amyloid. So you look at the mitochondria, you look at your hormones, you look at your thyroid, all of your hormones, by the way, your adrenal, sex hormones. We know that when estradiol goes low in menopause, it affects memory and mood, right? So that's important to look at, especially the black box warnings were now taken off recently by HHS because the WHI reanalysis was it was not quite as bad as they thought. But you look at neuro issues, psychological issues. Do you have fatty liver? I check any of my patients who have elevated liver functions. I send them for an ultrasound, and many times they come back with fatty liver. That requires weight loss, but insulin resistance, right, is one of the causes of Alzheimer's dementia, and it's associated with fatty liver. Just go through the 16-point MSIDS model with your doctor, making sure you're getting to sleep, exercising properly, keeping sugar out of your diet, stopping insulin resistance. But the point being, it's not a life sentence. There are things you can do instead of just going to your doctor and getting drugs like Aricept and Namenda or lecanemab. There's actually something you can do by going through the 16-point MSIDS model, checking these biomarkers, and then using a biofilm persistor drug regimen like dapsone combination therapy. And the way I've always done medicine is, what would I do for myself or my wife if I had these markers? That's what I would do. My wife at this point is 8 years in full remission from the dapsone protocol. She was sick for 25 years. So I know that it's possible for people to go into long-term remission. This ridiculous debate, is Lyme a chronic persistent infection, has now it's impacted even the Alzheimer's research or Alzheimer's, this epidemic we're having of Alzheimer's also. So it's just time to get a roundtable together like they did for Lyme a couple of months ago with HHS and look at the data and say we can do better. So it's an exciting time. And again, for people that are interested in reading about it, this book from Simon & Schuster, Ending Chronic Illness, is 640 pages long. I guarantee you, anyone who doesn't like this book and doesn't think it's useful, please send it back and I will refund your money at this point in time. You will not believe what I put in this book. This book will help you with differential diagnosis. It will tell you if you have resistant neuropathy, why it's there, if you've got resistant migraines, resistant GI symptoms. Every major chronic disease is analyzed according to the 16-point model, showing how all of the factors are there. And it gives you natural supplements, diet, exercise, natural ways of dealing with it, not just pharmaceuticals. For me, it's the most comprehensive kind of medical tome I've ever created. And it's kind of my gift for the world. It's my gift for all of you who are suffering. So I'm kind of excited for everyone to read it and tell me what you think. But I think you're going to find it provides clues for chronic illness that most people said, well, we can't really do much better. And the fact is, we can do better. So this is about hope, right? It's about hope and healing. So I'm really excited to share it with everyone. And the
And
website is Can Get Better for the consultation service, but endingchronicillness.com if you want to take a look at the book.
wonderful. And the book should be out by the end of the year?
It will be out by October, and I'll be starting book tours and speaking engagements. We'll be starting soon with Simon & Schuster. I'm starting to get on a lot of podcasts at this point. I'll likely, based on my talk with Mark Hyman, I'll be flying out to Austin, Texas to do a podcast with Mark about it. So yeah, I'll be out there kind of talking to people about what's in the book and basically how to use it.
That's great. And everything that we've talked today, again, it really does apply to all chronic disease. And, we're talking about Alzheimer's and we're talking about neuroinflammation, but just think of all of the other neurodegenerative diseases and illnesses that are to have neuroinflammation as a piece of the puzzle for their root cause. So this can apply to things like ALS and Parkinson's and MS and right and all of these other neuroinflammatory immune dysregulating sort of driven phenomenon in the body. This isn't
And chronic fatigue syndrome, myalgic encephalomyelitis, and fibromyalgia share the same symptoms as chronic Lyme, as does long COVID, as does
right.
mold, of fatigue, joint pain, muscle pain, sleep disorders, neuropathy, dysautonomia with POTS, memory concentration problems. So hold on. If you've been diagnosed with chronic fatigue, fibro, and you have not checked these biomarkers that we're talking about today of neuroinflammation, and they're positive, maybe even if your chronic fatigue and fibro was due to herpes virus 6 or EBV initially,
Yeah.
how do you know that Lyme or Bart or mold or other things are not underlying it, and that this is something you can do to reverse potential cognitive decline later on? I mean, it gives people like a whole new map of looking at whatever your chronic illness is. We even found with hiatal hernias, Crohn's disease, every GI disease I looked at, we looked at some of the big ones. The GI chapter in this book has that's 30 or 35 pages long on SIBO and SIFO and hiatal hernias and Crohn's and all these diseases and how the MSIDS factors are underlying what happens to your microbiome, where do vitamin mineral. So it's kind of like, well, you know this with Lyme, people don't come in with just Lyme disease. They have all these overlapping chronic illnesses. This is a way, it's a different lens of looking at it. And it's a paradigm shift, right, of how we look at chronic disease and basically keeping us all healthier, hopefully, and happier as the years go on. So it's exciting. It's not a gift I expected to give to the world. It was an unexpected finding because when I got the contract from Simon & Schuster, I didn't know that autism had all 16 factors. I didn't know that ADD. I didn't know that Crohn's had it. It's kind of like, oh my God, nobody knows this. I need to get this out to the world. It's really exciting. It's really.
It really is. And it's one of the things that I've been saying for years. Like, if we just focus on killing these organisms and we think that they're the only root cause, or, oh, we finally found the root cause, I always say at one time they were the root cause, but now they've changed the terrain, they've changed the cells of every organ system in the body. And so now you have to act like a detective and go in and figure out, okay, what of this patient sitting in front of me, what pieces of their puzzle, how has their terrain been altered? And now all of these things that you find are also now root causes that have to be addressed to be able to resolve the infections and reset the immune system in the end, so that when you're done with your antimicrobials, the infection can't just grow back, right? And we're taking care of all of these viruses that become so high because the immune system isn't, keeping them dormant as they should be once they've gone through their acute phase.
Yeah.
So I'm so excited to get your book and to read your book. And it really, it proves my point that I've been talking about for years, that we have to address the whole person, all the pieces of the puzzle, and for you, that's that 16-point MSIDS model. And it's just so exciting. So thank you for putting that all together for everybody.
Oh, it's my pleasure. And again, if you're a patient or doctor listening out there, please speak to your physician today about these biomarkers that we talked about today. I think very important. I think just as, again, you go for your blood pressure and your cholesterol check, we're in the middle of a dementia epidemic, and we specifically chose to label this conference the Healing Lyme 3.0, but looking at neuroinflammation and protecting the brain, because we now have ways of doing that in ways that we just didn't have before. So thank you for
No, and this
co-hosting. Yes, I really appreciate it, Mariah.
Yeah. And, this is such a scary disease, and these are really scary statistics. So to know that there is actually something that you can look at as a marker decades before, the worst part of the illness, and then something you can do about it, again, like, the message from this should really be hope to all of you that are listening.
Yeah,
So
absolutely.
thank you, everyone, for joining us. Thank you so much, Dr. Horowitz, and we'll see you soon. Take care. If this episode gave you an answer, brought you new insight, or made you think differently, subscribe to the Lyme Bites podcast and share with someone who's ready to take control of their healing journey. And if you can, please leave a review. It helps others to find the show. Thanks for listening, and we'll see you next time.